So, good morning. So, I actually have one particular lecture that I owe. So I think I will start first with the lecture that I couldn't give before I left Ondo. So we will start with that before we then continue with goal setting. Goal setting and formulating strategies, they are really the lectures for today. So first of all, let us begin with the critical issues in health planning. And then and also talk about the logical questions in actually planning generally, before we then come on to goal setting. So I will just share my slide now, and we just take it on from there. Okay, so let's start with this. Okay, so can you all see what I'm sharing?
Yes, sir, we can see.
Okay, very good.
Yes, sir.
Okay, so that actually reminds me, and for those of you who have already completed your proposals, if your supervisor actually approved, okay, you still need to get to me for a repeat of your pre-filled. So that probably might actually come up during the seminar week, which is either week 6 or week 7. So just for you guys to note. Okay, now let us come on now to the lectures. Critical issues and the logical questions in planning. Okay, so the question really is, when we talk about health planning, it is important that we understand what health is and what planning is. And so that if you are asked to define health, I know every one of us by this time should know the WHO definition of health. So who is going to help us? What is health? Jeshuto missing. What is health? So today I think I can call any one of you. Jeshuto missing. What is health? You see?
Okay, sir. Good morning, sir.
Good morning. What is the
Health is a state
WHO
of
definition of health?
complete physical, mental. Hello, sir.
And we continue. Start again. Start all over.
I said health is a state. Okay, according to WHO, health is a state of complete physical, mental, social well-being, and not just the absence of diseases or infirmity.
Okay, perfect. Perfect. So, and so that particular definition tells us it is a state. It is a state of the complete well-being, the physical, the mental, the social. Okay, not just the absence of a sickness or or to illness.
Permit.
And I think that is actually vital. So therefore, that is a state. Therefore, if we are planning for the health of a population, the health of a community, the health of a people, the health, well, particularly for those of you who are actually reading for MPH, health policy and management. Basically, this is going to be your key role. Planning, on how the health of a population can be sustained, can be maintained, can be improved. Okay. So therefore, you need to actually understand what you are planning for. We are planning to sustain, to maintain, to improve the health of a community, the health of a population, the health, and basically that is what health is. Okay, now what about planning? What is planning? Oluwafemi. Oluwafemi, are you there?
Yes, I'm here, sir.
What is planning?
So, planning entails organizing, thinking ahead of time, organizing specific steps with timelines towards achieving a goal.
Okay, fine. So, sincerely speaking, you have put too many Turinchi together. And the planning in its very simple language, it is the act of preparing a plan. Okay.
Okay,
but yes, everything you said is all correct. But if we are to say a simple definition, it is the act of preparing a plan. And therefore, when we talk about health planning, therefore, health planning is the act of preparing a plan, and of course, a plan to actually implement health activities to achieve the health outcomes, the health goals, to sustain, to improve, and to maintain the health of a population. Okay. Basically, if you are asked this in an exam, so it is for you to please define it in your own words, what health planning is. But you must show in your definition that you know what health is and what planning is. Now, more and more people are actually signing out. Okay. Okay, let us look at the critical issues in health planning. I am sure you have actually heard it often said that in Nigeria, that the problem of health management is not planning. I am sure you have actually heard it often said that, look, we know how to plan in this country. Okay, we can prepare any plan. Any donor that will ask us for a plan, we will produce one. Sharp. And that plan will be very, very good. But the issue of health management in this country, Nigeria, people have said that it is in what? What exactly do you think? And so that I don't answer the question for you.
Implementation.
Implementation. Implementation. We know how to plan. But for us to actually implement, to ensure that that plan achieves its health goals is always the problem of health management. Therefore, if we actually discuss what really prevents implementation of health plans, or if I ask this in another way, why do health plans in Nigeria fail? Okay, because that is what will lead us to what these critical issues are. And so please, now I want you, James, if you can actually come up here, no, and I want you to actually, tell us in your own view, why do health plans fail? What are the critical issues in the implementation of health plans? Why our plans usually fail to achieve their intended goals, the intended impact, the intended outcome, the desired outputs. Why do health plans fail? James, Ogna, start us off, because I will ask each of you to actually give me an answer, beginning with James. James Adeyemi, I think. James, are you there? Oh yeah, quick.
Funding can make a plan fail.
Funding. What about the funding? Is it not too much funding?
No, inadequate funding.
Okay, inadequate funding.
Funding.
Okay, fine. Therefore, that is one critical issue. That the money that the health workers need to deliver services usually isn't enough. The available funds do not go far enough. That is one critical issue. Yes, Oluwafemi, Nicola?
Lack of political will, sir.
Can you explain how does that make health plans fail?
At times, there is, because of the inconsistency of governance, in the sense that there's something called policy somersault. So government A that runs for 4 or 8 years has the intention, has a plan, health plan. It wants to do reduction in maternal mortality, comes up with a program to that end.
Yes.
But after the 4 or 8 years tenure, the new government that comes into power is not looking towards that direction. And then that leads to an entire failure in that program or plan that the government A originally had.
Okay, so is a corruption an issue, therefore? What do you think, Femi?
Corruption also could be because government B could be thinking that, okay, I'm not going to make so much funds in this program. If I continue, because it wasn't organized by me, it wasn't planned by me, so I'm not going to make so much money. Maybe that might be one of the reasons why government B chooses to look away from continuing in that program.
Okay, fine. Thank you so much. Okay, Bitoye, why do health plans fail, in your own view?
Corruption.
Oh,
oftentimes the money is diverted. The money for a particular project on paper is meant for this project, but at the point of implementation, the money is diverted or is not even
diversion of funds.
Yes.
Okay, and so that even if we have enough funding available, particularly with all these loans now that our government is actually collecting, World Bank is just very happily now dashing us money. And China now dashing us money. So that there is a surplus fund available, but the funding does not reach the implementation level of the plans that have been made. Okay, now thank you so much. Unatomi Singh. Jesu Tomi Singh. She's not there. Anthony, are you there? Okay, fine. To help you save my time, because I have
Yes, sir. I'm here, sir. I'm here, sir.
Why do health plans fail?
I'm here, sir.
Yes, answer. Give your own view. Why do health plans fail? We have said that the problem of health management, and particularly in Nigeria, is not in planning. And we have agreed that it is in the implementation. So then, what are the critical issues that affect the implementation? Jesu Tomi Singh. She's unmuted again. Okay, fine. To actually save my time. So basically, okay, when we look at that word now, critical, critical means it is, one, it is very, very important, okay? They are the key primary important issues that need to be dealt with in any particular area. So that when we talk about the critical issues in health planning, these are the challenges that actually hinder the ability of health plans to effectively meet the health needs of the population and achieve health goals. So that when we have to talk about the critical issues, we are talking about those important challenges facing the implementation of our health plans. And so that basically, if we look at this particular implementation, definitely we can find these issues in 5 key areas. 5 key areas why health plans fail. Well, yes, in Nigeria, but I think also generally, health plans fail for these 5 reasons. So, and okay, well, yeah, one is inadequate funding. Okay, funding and inadequate resource allocation for the purpose of implementing the plan. Okay, that has been mentioned before. Somebody also talked about corruption and poor governance, particularly what we have to hear before, that the government doesn't usually continue the plans started by the previous also government, and so plans are not implemented according to the desired plan, and so the desired outcomes are not achieved. So And I know that with corruption can be very, very different from the issue of poor governance. But it is possible both of them are actually related. Okay, now we also talked about lack of political will or political commitment, and the fact that actually, in a way, the fact that our politicians might not actually prioritize funding to the health sector. And so that even where the funds are available, even where support, probably external support, is available, the political will might have their priorities somewhere else. And so there is no commitment of those who have the political power to direct implementation, to prioritize the implementation of health plans for the achievement of health goals. And of course, there is this the fourth one, where we have ineffective financing schemes. Okay, and because in a way, in the health plans, the funding of health plans isn't only by the government. There are other sources. And so that if the health service isn't actually financed properly, the health plans might fail, because financing through the insurance schemes and the other ways that health services are actually financed, they usually need to actually support financing that comes directly from the government. So if that one too doesn't work well, then the health plans will fail. I'm sorry. So that particular first one is actually under underfunding. All four tell us how underfunding makes our health plans to fail. Now, the second one is the workforce issue. By the time we were discussing this, we actually concentrated on the government, but we need to also look at the service providers themselves. Very, very often we don't have sufficient workers, staff, and professional staff, the skill, the capacity to implement the health plan. Basically because of inadequate health personnel. And of course, how that one works is that actually the health in the service often have poor retention, okay, with the high attrition of health workers, particularly from Nigeria, the health workers who actually emigrating overseas. Many hospitals do not have enough staff to implement their health plans. Particularly if you look at this problem in the rural areas, there is also what we call unfair distribution of health workers. In the rural areas, health workers do not like working, that is in the villages. And so that the general hospitals, the PHC centers that are there, they are all understaffed. Okay, therefore, this is really, this is the second major reason why health plans fail. Okay, so the third major reason is poor infrastructure. Okay, when we talk about the infrastructure, no, we're actually talking about part of the services, the systems that are required for the people and for the population to access those services. The infrastructure, we also talked about the equipment, the technology. Okay, so very often the infrastructure that is available to implement those health plans, they are poor. Okay, so just like I said, particularly when you look at the health infrastructure in our rural PHC services, that is in the villages, in the LGA headquarters and all that. So poor infrastructure is the third critical issue. Okay, because if you have the health plan, then if you have enough funding, if you have enough workforce, if you do not provide them with the infrastructure that they need to implement those, to provide those particular services, or for those services to be accessed by the people who need them, then the health plan will fail. Okay? Then, well, this, so we already talked about poor governance, but this in itself is another major issue. When the health managers, so this isn't about the government now. This is about the managers themselves, those who actually manage these health services. If they do not govern health services, health projects, health programs well, and so that when you talk about poor governance, you are talking about poor coordination, talking about lack of a community engagement, and you're talking about the social determinants of health. When the health managers do not completely address them, so the health plans will not be properly implemented. Okay. So the fifth one is the excessive workload. The excessive workload. Now, definitely you can link this issue number 5. I'm sure you can actually link it with issue number 2. Isn't that so? And because if you have inadequate workforce and the government does not employ more health professionals, so you are going to have excessive workload. Okay? Excessive workload, therefore, can be caused by the fewer resources that will call that will cause what I have actually called here a resource workload imbalance. And of course, the epidemiology of diseases that is in the population is rapidly changing. More and more people are actually getting sick. Just as you have heard about the Ebola outbreak that is actually going on now, that is in the Congo. No, you could also have epidemics of cholera, no, and then in those times when you have too many patients, too many people falling sick, your health plan is going to fail if you do not have a contingency plan. And so, just in case you are asked to write a brief essay on why health plans fail, you will also be asked to give your recommendations as well. And therefore, now let us look at these 5 critical issues. No, what do you think can be done? Okay, so that the implementability of health plans can be improved, particularly in the Nigerian context. What will be your recommendations under funding? Let us just take them one by one. Okay. Anybody who has actually the onions, please just now come in now. Your recommendations for the critical issue of underfunding. Jesuito missing. Are you still there? Any recommendation to the Nigerian government as to how we can resolve the critical issue of underfunding?
Okay, sir. My recommendation would be that more allocation, more budgetary allocation should be given to health programs. Recently, I think last year, I think last year, earlier this year, the news broke out that probably 34 million was allocated for health in the whole of the country.
Yeah.
And that does not even translate necessarily to release.
Of course.
So the conversation now is that more budgetary allocation should be for health, and there should also be release of these funds. And there should be more sensitization on health insurance schemes, because government alone cannot fund healthcare.
Cannot fund it.
So we need to, especially the state-owned health insurance agencies, more attention, more priority should be given to them. They should work more on sensitizing the populace, so that, of course, NHIA, ODCAC are doing what they can do. But what about the informal sector? What about people? For those two agencies, they are working on federal, so it's mandatory for federal and state government. What about people that is not mandatory for? So if you can have a legislation that makes it mandatory for all citizens of the country, health insurance mandatory, that can also go a long way.
Okay, good. Okay. Thank you so much, Miluafemi. Lamiji, do you want to add anything here? No. If you are asked this in your semester exam, what particular recommendation will you give that will give you good marks?
Thank you very much, sir. He mentioned
resource
actually
allocation and
resource allocation.
Yeah.
Yes, and financing. So in the area of corruption, there should be a transparent way of administration of these allocations to ensure that it is actually used. Yes. It is actually used for what is meant for.
For good.
Yes.
Good. Yeah. And financial monitoring.
Yes.
And after budgeting, and after
Release
allocation,
of fund. Yeah.
and after release. Okay. Now the government should not just end there. They should also monitor to ensure that funds are used for the purpose they are meant. Okay, fine. Now let us look at this. What Jason told me, see, you haven't said anything today. Now give me, what will you recommend should be done to address the critical issue of workforce shortages?
Okay, sir. I think the first thing that can be done is recruitment is one of the things that should be done. Recruitment of qualified and skilled staff, and they can choose their available task shifting and task sharing to cover the workload. The another thing that can be done is motivating the current workforce, letting them know that they matter, and then increasing maybe their welfare package.
Better conditions of service.
Yes, sir.
Okay. And now about training more health professionals.
Yes, sir.
And in fact, even though there is the risk that the more you train, the more of them will want to emigrate. But at least you can actually train more to always refill the gaps of those who are leaving. And thank you so much. And then how about here?
Also, sir, I
Yes,
also want
continue.
to add that it's not enough to actually recruit. You should also make provisions for or retaining the people you have recruited, because you recruit and their welfare is neglected. Those people will definitely find his own level. He will look for somewhere else to go where is more appreciated.
Yes.
So there should also be retention.
Retention, better conditions of service. So that is very, very important. Thank you so much. How about here? How can we improve infrastructures that health workers need to implement their health plans? Yes, how can we improve? How can we develop health infrastructure so that health workers are able to translate their health plans into health action?
So I would want to talk about the technology and
Okay.
information system. I feel at this point, our health workers need training. I'm talking about primary health workers,
Okay.
especially.
Yes. Okay.
I was in a meeting one time where APIN said they wanted to give out laptops to facilities that run their program. And they were not interested in collecting laptops because they were not ready to move from the paper-based
they go and sell
information system. And the person was not saying, she was telling them, even if you want to use it to collect it, be watching movies with it. From watching movies, you will learn how to use it properly.
Yes.
So I feel we need to do a lot of training for our health workers so that they can adopt technology in information and data management.
Okay, very good. Very good. James, if you are still there, what do you think? How can we improve
also,
infrastructural
there's need for
development?
maintenance, to prioritize the maintenance.
Maintenance of our equipment.
Yes, sir. Then use of modular and portable solutions such as solar lightning kits.
Okay. And now about introducing mobile communication to actually improve technology. Okay, how we can use, for example, and for people who live in places that are actually that are physically inaccessible, particularly during certain seasons of the year. Okay, so if we actually introduce a mobile and a communication, another technology, we may also improve the implementation of our health plans all year round. So that basically we need to actually understand the infrastructural needs of our health services and then do everything possible to actually develop them, even if it means that you do more research, okay, to actually find out what infrastructure do we need to implement our health plans. So that also could be one other addition that will give you more points. Okay, then 4, please, I hope you guys know these five critical issues, because in a way you might be asked to write about them. So please go and read more about these five critical issues. Okay, now under governance, what recommendation will you give to improve the governance of health programs or of public health programs? Yes. Who is speaking?
Yeah, I think encouraging intersectoral collaboration, we strengthen
Multi-sectoral
governance
collaboration.
because it will reduce duplication.
Very good. That is very, very good. That is very, very essential. Okay. Yes. Multi-sector collaboration will help to improve the coordination, okay, and amongst all the stakeholders in the different sectors, and that can actually improve health governance. Okay, yes. One more person before we go on to the last one. Yes.
Oftentimes, some programs are run parallel to the community. Yeah. The communities are not carried along in the program. So oftentimes the community do not participate, do not get involved to benefit from those programs. So there's need for actual community mobilization and participation in order to achieve the goals of intervention or health programs.
Yep. Okay, good. Thank you so much. That is very, very essential. That is very, very essential. Okay, now the last one now, excessive workload because of the high disease burden and because of the imbalance of the resource workload ratios. I am sure that we know that the government has the government, I think it is that the WHO has a particular ratio of one doctor to so many patients, and where probably it is 1 to either 2,000 patients. I don't know. I am not very, very sure. But you can actually check them out. Or actually one nurse to either 5,000 patients. But the situation in Nigeria is that you have one doctor now serving a whole local government area of actually 200,000 for because basically that was what I actually observed during our NYSC. You will have one doctor, particularly in the north, a whole local government area. We have just one doctor based at DLGA in the headquarters, and that will be receiving patients from all communities within and outside that particular local government area. I don't know whether that imbalance has been changed, but if you are to give your recommendation that will address the high disease burden and this particular resource workload imbalance, what will you recommend? James, you haven't said anything here. No, what particular recommendation will you give for excessive workload?
In this area of excessive workload, it will be good to bring the idea of tax shifting and tax sharing. There are some legally tax that some nurses can handle, which the doctor usually does.
Yes.
But legally, the nurse can handle such, so we can shift that to the nurses to handle, thereby reducing the excessive workload on the doctor.
Okay, very good. Very good. Okay, good. So then how can we also reduce the high disease burden in the country? So this is a public health question now. Yes.
Okay. Thank you, sir. To reduce disease burden is actually a multifaceted, it's going to require a multifaceted approach.
Yes.
Where good nutrition we have to be encouraged, and then there's also need for awareness campaign on personal hygiene, environmental hygiene, and so on and so forth, so that people will know the risks in their environment and mitigate those risks in order to prevent the onset of infection or diseases.
Yes. So please, I actually advise you to go and read more, because I have only given you an outline. No, but you can expect a question for you to actually discuss why health plans fail in your exam. Okay? Okay? But I want you to go and actually research so that you can write properly. No, not just about the issues, but what actually causes them, and then how the issues affect the implementation of a health plan, and what your recommendations are to address these 5 critical issues. And it is possible when you go to actually research more, you might find more critical issues, which of course will give you more point in your exam. Please go and read on this further. So, and this is going to be a theory question. Definitely it will come. Thank you so much. Now, if we begin to now look at the logical questions, and I'm sure you have seen these planning in a framework before. Okay, that look every
yes sir.
Yes, every health plan is actually written in these 6 sections. The situation analysis that also includes that also includes the need analysis and the priority setting. Okay, and so that we have put those ones there, because when you are preparing your plan, that is the section that you put that. Then the other section of the health plan is the goal. We also talk about that. The next section of the health plan is the one on strategy. Then the other section is the section of your action, because once you know this situation analysis, you know the needs and the priorities, and you have set the goal, the next thing will be the action. That includes the activities, the task, the work. And then the fifth part of it is always the budget. When you have a plan, then you will need the budget. And so we say you end by you including certain assumptions of the factors that you feel might help the implementation of the plan, or the factors that might hinder the implementation of the plan. So the factors that could help, that could enhance the implementation, they are the ones we call benefits. The factors that could potentially hinder the implementation of the plan, they are the factors we call risks. So this is what we call a logical planning framework. But now, what are the questions that we need to ask, okay, that will help you prepare a proper logical plan? Of course, looking at that framework, you can easily see that the major questions, the first question is always about the current situation, because that is the question you answer when you are doing the situation analysis. So the question is about what is our current situation. In our planning cycle, we say the question you ask during the situation analysis is what? Where are we now? Isn't that so? It is possible you have already forgotten, but we have done the PMC planning cycle. So the critical question that you ask during situation analysis is about the current situation. And then for you to answer that, you need to do a baseline analysis of the population, of their context, and their problems, because they are what will. So, and basically, when we do a baseline survey before planning, the first question that you must answer is, what is our current situation? Or where are we now? Where are we now? Before you talk about preparing a plan. So, and then when you have properly analyzed the current situation, the next question will be, what changes do we need to make? And these changes, they are what we call the interventions. Okay, the interventions. Now, what are the changes? What difference do we want to make? We have understood the problems affecting our target population. But what do we do about them? And so that is the next question about what changes do we need to make. So there are three levels of changes. We already discussed this in class. One is the long-term impact. The impact you feel you need to make by the end of your program. Okay? Then two is the outcome. The outcome is the short-term change that you need to make. And then the last one is the output. The output is what? The immediate change that you expect after you have completed an activity. So the first question is what? The current situation, isn't it? Then you must answer the question of what changes do we need to make. And once you have decided on the changes and you have prioritized, then you can begin to then ask yourself, what goals do we need to attain on these changes? You actually might say, yes, you want to alleviate poverty. But what is your goal of poverty alleviation? Every change needs a goal. Therefore, when you talk about the impact, which is the long-term effect of your program, which is the long-term change, so the goal that you set, so connecting the impact is the goal we call aim. We will talk more about this. So the goal, connecting the outcome, the short-term changes, those goals are what we call objectives. We will also say more about that later. And then the goals, connecting the output, connecting the immediate change after an activity is actually completed is, well, it is called an output. Okay, but for you to actually understand, you can also call it the end result of an activity. It is a goal. So that you need to answer the question of the goals that your program needs to attain. And once you have answered the question of goals, the next question is what? What work do we need to perform to achieve our goals? Why we say this is actually logic is that they are all connected. If you have not answered the question concerning goals, you cannot answer the question of the work you need to perform to achieve those goals. So there are three levels of work. I'm sure, okay, yes. When we talked about the 5 levels of work, we talked about task. We talked about activities. We also talked about strategies. Then we also talked about projects and then program. But in your plan, you are planning the project, you are planning the program. You must talk, the first thing that you actually formulate will be the strategies. The strategies, then the activities to execute those strategies, and then the tasks to implement the activities. So once you know the work that you need to perform to achieve the goals, to make the change, and that will change the current situation of your target population, the next logical question will be resources. What resources do we need to do the work? Okay, resources. Remember, I actually told us that, look, when you talk about other resources, yes, there can be up to 4 or 5 types of resources. Okay, when you talk about the human resources and the personnel, then you talk about the tools, the equipment, the materials, the supplies, the logistics, the infrastructure, the superstructure. They all fall under the material resources. And then, of course, the finance, the budget, the money that will tell you how much funds to allocate to certain activities. And then we also talked about that, look, you must also develop the management systems. Okay, for each of these, human and a resource management and a system, and a material management and a system, the inventory maintenance system, and also the financial and management system, all of them. So that once you have the resources, you need to sit down to actually design, prepare the management in the system, which in itself is a resource. And of course, you must also allocate time. Time is also a resource. So that you actually talk about how many M's now? MMMT. Okay. Okay. Yeah. How many M's?
3 M's and 1 T.
I think they are 4 M's.
Oh, okay, sir.
4 M's. What are those 4 M's? I just described them. Yes?
Money, material, manpower.
Yes.
Okay, yes. I think there's another one. Management. It's 4 M's,
Management
sir.
system, yeah.
Management system.
So 4 M's.
Money, manpower, material, and management system, and time.
And time. MMMT. Okay, good. So, and then, of course, when we talk about the assumptions, what conditions must be met for our plan to succeed or for our plans to fail? You must think about both sides of the coin. Okay? In planning, think about the conditions that must be met. Therefore, you talk about risks. What are the issues, contextual issues that might make our plans to fail? You are talking about risk. And so you must need to also think about how those risks will be mitigated. And then think about the benefits. So please remember these 6 logical planning questions. They are logical because they are connected. You must understand the current situation before you can decide on the changes to be made, and then decide on the goals to be achieved regarding those changes, and then the work to be performed to achieve the goals, and then the resources that must be supplied for the work to be done, and then the conditions, the risks, the benefits that must be considered as the potential threats or opportunities for our plan to be successful. Okay, so well, if you have any question concerning this, please ask. Because when we think about logical questions in health planning, These are the questions that should help you. Questions relating to the logical planning framework. Can you see any connection between these questions and this logical framework of a project plan? So they are the questions that will help you prepare a plan that will produce a plan that directly addresses the problems of your target population. So now there is another question which is not here. So this question is, which you can say is the seventh question, is how will we assess the performance of the plan? By the time we were talking about the critical issues, somebody said that actually the funds that are released are not actually monitored, and therefore the plans fail. So this is another question that you should add to these ones. So we have 1, 2, 3, 4, 5, 6. Make this one the seventh one. How will our performance be assessed? Because that is what will lead you to think about how you will audit the resources, how you will monitor the activities, and how you will evaluate the results. So, yeah. Okay, so basically, 7 questions. What is the current situation? What changes do we need to make? What goals do we desire? What work will we perform to achieve the goals? What resources do we need to implement the work plans? Then what conditions must be met? And then the 7th one is, how will we assess our performance? How will we know whether we are doing well or not? So we audit our resources, monitor the activities, and we evaluate our results. Any questions on this? Okay. Maybe before you ask the questions, there are these 7 frames that I'm sure we already talked about this in class. 7 questions that actually describe the outline of every plan. Every plan answers these 7 basic questions of what do we do? When do we do it? Where do we do it? Who will do it? Which tools or materials will we use? Why do we do it? And how? So these are questions that actually relate to the components of every plan. Every well-prepared plan must answer these 7 questions. But when we talk about logical questions relating to the logical planning framework, these are the 7 questions. Any question here? Mary, you arrived very, very late. I hope you actually gained anything. Any questions here concerning logical questions in health planning? Do I take it that we don't have any question? Ognadeola, and you also came
no
late.
question from my hand, sir.
Ogna, no question. All fully understood. Okay, good. Please note this, because these are all very, very important questions. Okay? And so that now, if you don't have any question for me, Can I ask one of you to please detail out, and for example, how will we apply these 7 logical questions to a malaria control program as an example? No, just give me one answer to each of those 7 questions. Who hasn't said anything? Ognadiola and Mary, you are welcome. You have not answered any question today. So if you look at those 7 logical questions in health planning, can you apply them to your preparation of a plan to control malaria in your community? What will be the first question you will ask, and what will be the answer? Nifemi Mary.
Yes, sir. Good morning, sir.
Good morning.
Yes, sir. The first question to ask is, who are the people affected?
Oh, Unadiola, do you agree? Is that the first question? Adiola? The people are not here. Ntomisi.
Yes, sir.
Yes, sir. The what question, the answer, what is the population? Then what is the context? We want to look, we want to look at the population.
Have I have been talking since. You see, I gave you people the opportunity to ask. James,
hello, sir.
Wait, James, please help us, James. We have just looked at 7 questions, logical questions that must be asked when preparing the logical plan. So now, if we actually relate it to a malaria control program, what is the first logical question you ask?
We look at the current situation.
Ask it as a question. What is the current situation of what?
We look at the population of the people affected.
The population, thank you. Thank you. Their current situation, and then you look at their context, and then next, okay,
Problem.
their problem. So now, if you're asked in an exam, apply this question to the planning of a malaria control program, you must give examples. No, malaria control program examples, talking about what is their current situation. You have to give an example about what maybe the problems, the incidents, and the prevalence, the deaths due to malaria. Okay, how many hospitalization that occurs due to malaria? Okay, and how that affects the population due to malaria. You give malaria examples. Do we understand? Mary?
Yes, sir.
Good.
We do, sir.
Please. Okay, then what is the fourth question you ask? Using also malaria. Lamiji.
Okay, sir. The fourth question is to ask where are we going to do the malaria control? Where we are going to control the malaria?
No, logical question.
Okay, yes, sir.
So
what are the works to
people will
perform?
get confused during exam. There is a particular course. In a particular course, HPM 711. That particular course and 9 people wrote the exam. And 7 of them wrote out of point. Out of point. There is a difference between the questions you ask about the component of a plan, which is the what, where, when, which, why, how. Okay? About what
Yes,
a
sir.
plan should contain. Different from the logical
Question in
questions you
planning.
ask during the preparation of a logical plan or of a logical project plan. Which, now the first one is what? What is the current situation? What changes do we need to make? What goals?
Goals,
attain on
what are the goals we need to attain?
And then what
Then
are
the fourth one,
is
work
the
to
work
work
to
to
perform.
do to
perform,
The
achieve those
work
work to
to
goals?
perform
perform.
those goals.
Okay, and then once you have the work,
What resources
what
is needed to
resources do we need?
perform?
Okay, then the conditions that must be met. Then the 7th one is what? How do we assess our performance? Okay, please. It might probably appear as if I am actually giving you guys the expo. These are the questions we will commonly ask. And if you write on something different, the best I can actually do for you, instead of me giving you 0/20, and I'll give you 2/20. And maybe that too will actually help you somewhere else. But please be very, very specific, okay, so that you know what to write. So now that is about the questions. Now let us go now to the lectures that I am supposed to be teaching today. So all we have done so far is about a lecture we missed, okay, before. Today we are talking about goals, goal setting. I actually enjoy this particular lecture because my PhD was done on the goal setting in the practice of a health care organization. And I actually used 4 good years to actually study about goals in my PhD. Therefore, please, I like the teaching about goals because that is where my own passion is. So now let us just quickly go now and just go through we don't need this anymore. So let's go on and talk about goals. Let us talk about what goals are. Let us talk about how we set good goals. And then if we have time, we can also talk about how we formulate the strategies. So let us begin by trying to answer the question, what is a goal? I'm sure I have asked you this question before in class. So now let me see how many of us still remember these things. So, what is a goal? Mary, I will come back again to you. What is a goal? We answered this question in class. Moses, Nifemi, Mary.
A goal is a target
A
being
goal,
placed.
a target. Was that how we defined it in class? Okay, now who can they help us out? What is a goal? How did we define it in class? We already defined it before.
A goal is a desired result
A desired result of
or
an
outcome.
action. Okay? A desired result of an action. Okay? Desired to be achieved at a specific time in the future. So that when you talk about goal, it is a result of an action. Okay? That is desired to be achieved at a particular time in the future. Either so please, Mary, can you write this down because you will need it. Please, Mary.
Okay, sir.
Don't tell me if I ask this in an exam that a goal is a target. A goal is not a target. Okay, it is a desired result. Okay, to be achieved at a specific time, at a particular time in the future. Now, Unafemi, we have not heard your voice. Why should we set goals? Why are goals important?
Well, setting goals are important to give direction.
Okay, direction. In the direction, yes.
That is what will help us come up with strategies, tasks, and
Okay.
activities that we
Okay.
can undertake to achieve that goal.
Okay. Thank you. Tommy Singh, in your own view, why should we set goals in a plan? Tommy Singh and Tony.
We set goals so that, yes, sir. We set goals so that we'll be able to measure our progress and our
Very good.
success,
Yes.
to evaluate the performance.
To evaluate performance. Very good. Okay. James.
For accountability purpose.
Okay. Okay.
We set goals for accountability purpose.
Okay, good. How does that work out?
Clear goals make it easier to hold yourself or others responsible for the tasks given to them.
Thank you so much.
It makes them take responsibility.
Yes. Just as now, the whole country is now holding our government now to their promise. Somebody said, if I don't give you light 247, if I come back again to ask you to vote for me, do not vote me in for the second time. Which means he set his goal when he was only campaigning for his first term, isn't it?
Yes,
and
sir.
now the government is now holding him accountable. Now you have set your goal. Now do it. And we are praying that God will give our government the power for them to fulfill their goal for Nigeria to have light 247. That's a powerful goal. We pray we are able to achieve it in Jesus' name.
Amen.
Amen. Thank you. Okay, who hasn't spoken? Ogbeiwi. Why should we set goals?
Okay, goal is often directly related to the purpose of intervention, as in related to the intervention the result of the intervention we want to undertake.
Yes.
So we set a goal to actually to be the result of our intervention.
Okay. That is the goal, but it doesn't tell us why. The question is, why do we set the result of our intervention? Why do we need to know the result before we perform the intervention?
Yes, we set goal to actually to keep us on track in achieving to keep us on track in achieving the real target for our intervention.
Okay, good. Okay, now Mary, now okay, now give it a shot. Why should we set goals?
We set goals in order to evaluate if the action taken has actually, like, to track our results, to know if it has given a positive changes or not.
Okay, good. That is actually correct. As the benchmark for us to actually monitor the progress, the benchmark for us to know whether the program, the project has been successful or not. So now the other way you can understand the importance of goals is if you can just imagine a plan without goals. A plan that talks about the problems you want to address. A plan that talks about the work you want to do to address that problem. And then the plan gives budget to implement the activities. What do you think people will say about such a goalless plan? Yes, it is possible you haven't ever thought about a goalless plan, a plan without goals. I tell you, there are many plans out there without goals. They will talk about the situation they want, the problems they want to address, and then the work they will do, and then the budget, but no goals. Honestly, just from what we have all said, that any plan without goals is a baseless plan, because such a plan, the activities, the strategies, it lacks a basis for the plan to rest on. Because people will always ask you, what do you want to achieve with your plan? And goalless plans cannot answer that question. Goalless plans, you can't monitor such plans. You cannot evaluate such plans. Like, somebody said, you don't know the direction that the program is going. If there are no goals in a plan, why are you implementing this plan? So the goals therefore set your direction. The goals therefore give meaning to your implementation. The goals therefore set the scope of your work. The goals therefore form the benchmark for your measurements. The goals, I can go on and on and on and on. Without goals, and I think it is in a law that says any argument that rests on a nothing, there's a way they say it. So you can't build anything on nothing. Therefore, if you prepare a plan and you don't set goals, you are building a whole intervention on nothingness, because you won't be able to make any meaning. You won't know whether you have arrived at your destination or not if you did not set goals ab initio. So that is why we set goals. So goals are very, very, very important. So in this particular outline, so now, yes, we actually thank God for Arsenal. So now we can say we have scored a goal. So a goal is the purpose. A goal is the result of a planned action. Okay? So please note this definition. Okay? I actually plucked these particular definitions out of my book. Okay? It is the purpose of implementation or the result of a planned action expected to be achieved at a specific time in the future. Okay, it is what the program, the project aims to achieve. But in health management, we use the word goal generically. And that is how we understand you to use the word goal. The word goal is what? It is a generic term that refers to all desired achievements, all results. So goal covers a number of terms that are used interchangeably. Some people talk about aim as a goal. Some people talk about objectives as a goal. Some people talk about the target, a Mary, as a goal. Some people talk about different things, but they are all talking about the different types of goals. Do we understand that? Yes?
Yes, sir.
Good. So,
Yes, sir.
and so that when you talk, so this, it is possible you have heard about all these different types of goals before. Vision. A vision is a goal type. Mission is a type of goal. Aim is a type of goal. Objective is a type of goal. Output is a type of goal. Target is not a type of goal. Does that shock you? Why
Yes,
do
so
you
it
think
did,
I
sir.
am saying target is not a type of goal? Yes? Do we have any juniors in the class? Why do I say a target is not a goal type? Okay, I will tell us this. Goals, they are measured using indicators. Target is a level of an indicator, and therefore it is not the goal itself. Target is a level or a measure or a desired level of an indicator rather than the result or the change that you desire. So the target is not the goal that you wish to achieve. What you desire to achieve is the change connected to your goal. I will explain this further. As an example, you have a goal to eliminate poverty. Okay? The goal is what? Elimination of poverty. That is the change. The change, the result is the goal. But for you to know whether you have achieved your goal or not, you need a measurement tool, which is this, which is the indicator. The indicator measures progress or otherwise towards your goal. So the indicator is not a goal. The indicator is a measurement tool that you use to assess progress towards your goal. So in the example that I gave to eliminate ethnic poverty, the indicator will be the poverty rate. The poverty rate is the indicator and it is not a goal. So if you have the poverty rate, you can say that poverty rate, our target by the end of 1 year will be 30%. So that 30% is your target. It is a level of what? Of the poverty rate that you are using as the indicator to assess whether you can achieve the goal of eliminating poverty or not. Have I confused you further? Do you understand? Oh, now somebody answer
Yes,
me.
sir. Yes, sir.
Okay, you now understand why I say a target is not a goal.
Yes, sir.
Please
Sir,
understand.
I am trying to understand,
Okay,
but I don't know if you can help us put it in practical terms. Maybe like give an example of how a goal was set and the target that is now used to measure it
yeah. And
that
I
now
just,
makes it different from a type of goal.
okay, good,
Maybe that will help us understand, sir.
good. I actually gave you an example. Okay, you want, your goal is to eliminate the poverty amongst women in a Farichiki village. That is your goal. The long-term change or the short-term change, eliminate poverty. That is the goal. But how will you know when you eliminate the poverty? What is the measure? We say every goal should be measurable. So for you to actually measure the elimination of poverty, you need an indicator. One example is what? The poverty rate. Indicators, they are usually quantitative measurements like rates and a percentage, an average, or proportion, or ratio. Okay? So those are indicators that measure whether you are achieving your goal or not, or whether you have achieved your goal or not. So we call that one indicator. So, but you now ask yourself, on this indicator, what level? Take an example, a thermometer. No, as an example, on a temperature, you want to actually reduce a child's fever, no, no fever for the temperature to become normal. So the indicator to actually measure the heat in a child's body, no, whether it is going down or not, is a temperature. But you actually measure temperature using a particular level on a thermometer that you want to bring down a child's as examine the temperature from maybe 40 degrees, which is actually hyper, okay, in centigrade, to actually bring it down to actually to 36.5 and 7 degrees centigrade, which is the normal. So now the goal is to actually reduce a child's as a fever, okay? But the indicator is a temperature. The target is a level of a temperature, of a level of that indicator. Your goal is to reduce or to cure the fever. The indicator is a temperature. The level of the temperature is your target. Do you understand?
Very clear now, sir. Thank you, sir.
Okay. Okay, now Mary, do you also understand? Hello, Mary, do you understand? Tommy Singh, do you understand? Okay. People are doing other things.
Sir. Yes, sir. I understand.
Okay, good.
I'll do it video.
Okay, now let us now come back here now. Now our time is going. Now vision is a futuristic goal. It is a goal that actually defines the relevance of an organization. Every organization lives because of its vision. So, as an example, WHO once had this vision of health for all. No, but what now worked against them was that they put a time frame. Visions do not have time frames. It is a rolling goal. As long as your vision is not yet achieved, then the organization has a right to say it is still relevant to exist. Vision is the futuristic goal. It is a rolling goal, timeless overall purpose statement. It is the existential goal of a program or an organization. And for example, health for all. And I once worked with an organization called the Leprosy Mission. Their own goal, I think it is, their own vision, I think it is still their vision. Their vision was a world without leprosy. So that is a future goal that they will continue chasing till their kingdom come, until they can succeed to remove the last leprosy patient from the world. That is a vision. The mission is a core value statement that shows your vehicle to achieving your vision. For example, WHO says health for all. And currently they have actually tied it now to universal and access. Okay, now their health for all vision is now tied to actually giving everybody in the world access to the healthcare they need. Okay, so that in that process, they are not hindered but by any financial difficulty. So this is how WHO now defines their health for all on a vision. And their mission is actually PHC. No, the PHC is basically their strategic mission for achieving health for all. So that in a way, PHC, and I know that I actually asked those people who did HPM 817 to define the PHC. But the way PHC is actually defined, how it is defined is a mission statement as to how the health for all will be achieved. And it is different from the aim. The aim is the broad, long-term goal. So the aim is a strategic goal to be achieved in 5 years or more. Objective is a smart, short-term outcome statement. So aim is related to the impact, long-term impact. Objective is related to the outcome. Output is reconnected to the end result. Basically, when you are writing your output, you say for each activity, this is the end result we expect after the activity is implemented. So that here you have 5 different types of goals: vision, mission, aim, objective, outputs. So please go and actually read more so that you can define each of this, because you need to know how to professionally define vision, mission, aim, objective, and output, and differentiate them from standard, indicator, and target. A standard is not a goal. What is the difference between a standard and a goal? Who can help me? What is the difference between a standard and a goal?
I think a standard is just a rolling. I don't know how to put it now. Why a goal is time bound? A goal has a time. It has a achievable time for goal, but for standard, it's always there. It's like we have a goal. We have a standard in our organization of always doing something, or this is the way we do things in this organization.
Yes.
So, and it's always there.
It is always
goal
there.
is like, okay, yes, we want to achieve this is what we want to achieve within so time.
Okay, good. And thank you so much. So while goals are the measure of change. Okay, a measure of changes, either long-term change, short-term change, immediate change. And standards, they are a measure of the at the minimum level of a quality that your resources, implementation, project, and the strategy must always have. The minimum measure of a quality. Okay, and that is why it is not a goal. A goal is about a desired change. Do you understand? The desired change after you have done work for a period of time. That is a goal. And the standard is the minimum measure of a quality expected in your implementation right from day one, and it must maintain it all through. So for your project or program to achieve goals, you must have attained the minimum level of quality, which is the standard. Do we understand? So that is the difference between a goal and a standard. Goals are about measuring changes over time. The standard is about the critical measure of the quality of work or result desired at any time from the beginning of a program to the end. Please understand this, and then you can go and read more about this as well. So now, how do we differentiate those 5 goal types? So the way we differentiate the 5 goal types is by these 7 criteria. So 1, the goals, they are different in the object that they assess. That is, the object is the change. The change that they assess or that they relate to. For example, a vision is a futuristic goal. It is something that is always there. Aim, the object is the impact. Objective, the object is the outcome. Output, the object is the end result. So you can differentiate aims, objective, and output based on the object that they assess or that they refer to. And the next thing is how broad, how specific they are. The aim is a broad goal. The scope is wide, okay? And it is not as specific as an objective. For example, okay, a goal can say you want to reduce deaths of mothers in a village. It is not actually specific as to what they want to do. Unlike an objective that will say they want to actually reduce the mortality so that the number of deaths drops by actually 80%. That is being very, very specific. So aim is broad, but objective is a specific goal. Output is a specific result. They also differ by their measurability. The aim cannot be quantitatively measured. Okay? Aim, because they are broad, they are a qualitative expression of the impact desired. Therefore, anything qualitative, you can't measure them quantitatively, even though many researchers try. They say they will use Likert scale. By them using that scale, they actually convert qualitative variables to quantitative measures. But when you are setting your goals, aim is not measurable because the expression is qualitative. Whereas objective is a quantifiable result. And then the goal types differ according to their hierarchies. Okay, there is the top level goal, which is the aim. There is the middle level goal, which is the objective. And then there is the low level goal, which is the output. So that hierarchy differentiates the goal types. Then time frame also differentiates goal types. We have aim, that is the long-term goal after 5 years or more. You have objectives, that is the short-term goal, usually 1 year, 1.5 years, 2 years. And we have the output, that is the immediate goal. Immediately after an activity, you measure the output. So, and then the goals also differ by the way they are written or expressed. Okay? Aim, which is the broad goal, is expressed qualitatively to reduce maternal deaths by 2015. It is qualitative because you have not included any quantitative measure. But the objective is a SMART goal. It is SMART because it is what? It is actually specific, measurable, attainable, realistic, and time-bound. So objectives are expressed in a SMART format, while a goal is expressed in a qualitative format. So the way we express the goal types make them different. Then the last thing is the way the goals are interpreted. Okay, aims, the way we interpret an aim, if it is achieved, we say the program was successful. If the aim was not achieved, we say the program has failed. Objective, we don't interpret it that way. Instead, if the objective is achieved, we say the project or the program or the work done was effective or efficient. Okay? And if an objective was not achieved, we say the program, the project, or the work done is ineffective or not efficient. So that these are the 7 criteria that you can use to differentiate aims and objective. Output is a specific end result. So the output can also be said to be SMART. Okay? So like objective. But aims and objective, you can differentiate them using these 7 criteria. Please note this. So now basically, this is what we want you to know about aim. It is the first type of goal that is set when you are planning any program. After the situation analysis, the first goal that you set is your long-term goal. You set your aim before you set the objectives and the outputs. That is because the aim is what gives direction to your objectives. It is a broad goal, okay? And it is the goal that actually defines the purpose of your program. and it reflects the success. It is expressed as a qualitative statement. Objective is the second goal that you set in a plan. Okay, people have said it is the milestones you achieve on your way to achieving the aim. So you must achieve your objectives if you are to achieve your aim by the end of your program. So it is smart. And then if it is achieved, it signifies the program's effectiveness. Do you understand what I am saying? And then the output is the third type of goal in a plan. It is like the objective, it is a specific goal. And you express it as the result you want to achieve at the end of an activity. And it also tells you whether that activity, that work, that intervention is effective or not. So these are further areas that you can use to differentiate the different levels of goals. Differentiate them by their timeline, differentiate them by the people who formulate them.
You're muted, sir. You're muted, sir.
Yes, I am back. So now saying these goals, you also differentiate them by the stakeholders who formulate them and the stakeholders that they affect if they are not achieved. So usually the long-term goals, national program goals, the medium-term goals, the objectives, the project partners, and the community partners. So then the planning level, the measure, the statement, the result, and the level. So the long-term goal is the impact and the result. The objectives, they are the outcome result. And then the short-term, the immediate goals, they are the output to results. And then the work that needs to be done to achieve them. Achieving the output is the responsibilities of the workers because they perform the activities. Project activities and the strategies, they are what must be done to achieve the objectives. And then the higher level activities. So basically, these are the goal types that I found in an organization that I did my PhD research on. So now when we say what is goal settings, sorry, and I know my time is up. It is already 1 o'clock. Should I end here or I finish this particular lecture? What exactly do you want, class?
Let's finish this particular lecture. That's what I would suggest.
And the class, what exactly do you say? Because actually my own time is up. Should I continue here?
Yes, sir, I can continue, sir.
Okay, fine. Now, goal setting, therefore, by definition, it is writing clear, well-structured statements, okay, okay, that express goals. So basically, just as I said when I asked you to define health planning, goal setting is just the act of formulating goal statements, okay? And then for you to set goals, you need what we call a goal framework, a goal and a structure that tells you what the goal statement must contain. So that if you know the framework of a goal, you should be able to formulate goal statements anytime you are asked to do so. So these are examples of goal setting frameworks. I'm sure you have heard about the SMART goal framework, SMART. So people have used these SMART criteria as a framework to formulate specific goals. Okay, so they ask the questions, and then when you answer those questions, they will guide you to formulating a goal that is SMART. They will ask, is the result you want to achieve in a specific? Or is there a specific result or change that you want to make? Okay, is it measurable? Is it attainable? So they will tell you what to do for you to make them SMART. That is the SMART framework. Then you have these other setting framework that I derived from my PhD study, and they are published. And so you can cite them. You have the OITT framework. You have the CBITT framework. You have the IT framework. And you have the CBLT. Okay. OITT just means outcome, indicator, target, time frame. Okay. So that if you want to formulate objectives, like I have asked you to do for your health planning assignment, all your SMART objectives must have 4 things. What are the 4 things your SMART objectives must have?
Outcome, indicator, target, and time frame.
Thank you. So all you need to actually remember is the OITT. What is the outcome? The outcome is the short-term change. What is D indicator? The indicator is the quantitative measurement. What is the target? Target is the level of the measurement. What is the time frame? Time frame is the time or the period. So that when you put all this in a goal statement, we say your statement is SMART. CBITT is the same thing, but just puts it in another way. The only component that is added there, they are the beneficiaries. Change, beneficiaries, indicator, target, and time frame. So that you can remember the OITT, or the CBITT when you are formulating an objective statement. The IT or the CBLT is for you to formulate a long-term goal or an aim. IT just means you state the impact and the time frame. And for example, the impact to reduce the maternal mortality time frame in the next 5 years. So the aim in the statement, therefore, will be to reduce the maternal mortality in the foreign chicken in 5 years' time. That is an aim statement, easy to formulate. Just state the impact and the time frame. But because you need to also measure, to also mention the community, the target population, so we say you should add the beneficiaries and their location, so that once you have used the IT, you can rewrite your aim in a statement to reduce the maternal mortality in Abuja, among women in Abuja by the end of 2031. So you mention the impact, the people, the place, and the time frame. So please remember these goal setting frameworks. Okay, SMART, OITT, CBITT, IT, and how they are used. So there are two goal setting theories that I want you to go away with. There are many goal setting theories, but this is one that we want you to know in your HPM course. There is the Locke and the Latham goal setting theory, which states that specific and difficult goals are more likely to motivate workers' task performance towards goal attainment than ambiguous or easy goals. Do you understand this? What this theory says is that if you want your health workers to be motivated to perform their task and achieve their goal, make the goals specific and difficult than to make it easy and ambiguous. So that is what this goal setting theory. So this particular theory is also called the goal. It is also called the theory of goal motivation and task performance. But now there is this other theory that I formulated from my PhD study, which is called a practice theory of goal setting, that says goal statements will be smarter and plans more realistic if the goal setting process is collaboratively performed at all stages of the practice by all relevant project stakeholders. Yes, so this particular theory, I hope you can understand it. It says that if you can make your goal on a statements smarter, then the resulting plans will be realistic on the condition that the goal setting process is a collaborative goal setting in which all relevant stakeholders are involved. So this explains it better the other way. This one says that if your goal setting process, if it is actually centralized, if your goals are formulated by one person, the resulting goals will be what we call assigned goals, and they will most likely not be smart, or they are not smarter because they are not agreed goals. Okay, and then if they are not smart, then the project plan will not be realistic because the people who will implement the plan to achieve those goals were not involved during the goal setting process. Please, if you have any question, just ask me, please. Just ask me, please. So now for you to actually formulate goal, maybe during our next session, we will have a practical session on us actually formulating goals. So I will ask you to actually formulate goals, and I can guide you so that you really formulate goals that are smart. Okay, so there are 4 stages in a problem-based goal setting process. And these 4 stages are: 1, preparation. When you are preparing, you set the time, you select the community that you want to actually prepare a plan and to set goals for, and then you inform the staff and you go. That is the preparation stage. Then you carry out a baseline survey. Survey is when you go to the field and you collect evidence, you perform situation problem analysis in the field. And then you come back with the results of your baseline survey, and using a consultative forum, the manager and his or her project team sit down and then convert the problems into goals. Problem changes goals. We already did that in class. Okay? Problem changes goals. So, and if the goals are agreed, then we call that process as a smarter. The goals that you formulate, if they are smart and agreed, we call it smarter, where the A means agreeable. Therefore, smarter goals are what? They are specific, they are measurable, they are attainable, they are realistic, and they are agreeable because everybody participated in the formulation of those goals. So then you use those goals to now plan your action plan, your work plan, and the plans. And so, therefore, the practice theory says your plans will be realistic if your goals are smarter. And if you formulate those goals and you prepare those plans using these 4 bases. So, to just give you examples and then we close. So, the example of an aim can you see this example here that says the aim statement of a proposed poverty alleviation project? This was the case study we did in class. Different from the case study that I gave you for your assignment, but the process is the same. Okay, so an example of an aim using the CBLT to reduce maternal mortality due to poverty. That is the impact, the change of peasant wives. Those are the beneficiaries in a foreign chicken village. That is the location. At the end of 5 years, that is the time. So that when you read it together, you can see that this is a well-formulated, qualitative, long-term, broad goal, which we call aim. So writing an objective, for it to be OITT compliant, for it to be a short-term goal, you need to state the outcome. For it to be a measurable goal, you need to state a quantifiable outcome. For it to be an attainable goal, you need to state the target level of the indicator. For it to be a realistic goal, you must consider the target in the context and the constraints of your program. Can it be achieved within the reality of the context in which the program will be implemented? To be time-bound, you state a short-term time frame, usually 6 months, 1 year. Okay, I think this is now the last. Okay, this just shows you basically explaining what I have just done, what I have just said. And specify the outcome. And for example, the indicator, for example, the target, and for example, okay, and then the realistic time frame, and for example. So when you put all OITT together, that gives you an example of a SMART objective statement. So, so from that, an example of an objective statement is to alleviate poverty or improve the economic empowerment. That is the outcome, that is the change, of a peasant and farmers in a foreign chicken. Those are the beneficiaries. So that the poverty rate, that is the indicator, drops from 80% to 60%. That is the target. By the end of 1 year, that is the time frame. So, any questions? So that is the end. So, so I still owe you how to formulate internal strategies. So, at our next lecture, which is actually tomorrow, we will begin from there. Any questions? Please ask questions now, because I am tired of marking answer script where people shows they do not understand the topic while it is being taught. If there is anything I have said about how to formulate goals, aims, and objective, and the goal types, the theories, the goal framework, please, any question? Okay. And I take it that it is not that you don't have any question, and I take it that everybody is tired of my lecture. Thank you so much, everyone.
There's no question from my head, sir. Thank you, sir.
Okay.
No, sir. Thank you, sir.
Did you understand anything I said?
Yes, sir.
Okay. And I have also given you hints of questions you should expect in your exams.
Thank you, sir.
Now, did you pick that?
Yes, sir. We picked a few, sir.
Okay, good. So now, thank you so much, everyone. And I'll see you tomorrow.
Thank you, sir.
Yeah, bye-bye.
Thank you, sir.
Thank you.